Hey, so today we are talking about second opinions and why they are so important. So if you've been following along with me all week, you've kind of gotten a little bit of my story about me having 3 herniated discs, had an episode in November, serious low back pain where I couldn't even walk, and went to the ER. It was muscle spasms, still had herniated discs. Obviously, those don't go away. I was concerned I ruptured a disc. So finding out I did not have a ruptured disc was actually like, oh, yay, I don't have a ruptured disc. So when I was at the ER, they had given me a referral to see, as they call it, the back specialist. And, of course, I kind of looked him up online. And I was like, all right, cool. Well, in the meantime, prior to all this happening, I actually had an appointment at my regular general doctor. So I, of course, filled her in on everything. And I said, this is who I'm going to. And she says, oh, he's good. He won't put you through surgery. He doesn't do unnecessary surgery. So I was like, oh, all right, cool. Because he's a surgeon, right? So I go to him and I can't remember if I brought a copy of my MRI with or not. I believe I may have. So anyway, I go in there and this guy literally walks in and asks me about 3 questions, which is fine. Does this little exam, which was a slight neurological exam, which I kind of knew that was what it was. And I knew that I did just fine with it. And right away he says, in my opinion, and he goes, and I'm a surgeon, you can benefit from a small surgical procedure because you have a severe pinched nerve. And I think at that moment, my jaw hit the floor because I was like, say what? I mean, I know I'm in a lot of pain and I know that it's hard for me to move around, but I just don't feel like this is the solution. So in my mind, right then and there, I was like, I've just stopped listening to him at that point. So he was asking me like what I had done in the past and all this other stuff. And of course, he wanted to know what my insurance covered of chiropractic care that I had been going to, how much it cost, all kinds of strange questions that made me feel slightly uncomfortable. Which at that point, again, I kind of stopped listening to him. And in my mind, I'm having this conversation with myself like, this guy's nuts. He thinks he's going to perform surgery on me, and it's not happening. So at that point, he's like, well, I'll order another MRI. And I said, I get it. I said, I understand. Surgery can be an option. I said, but I'm not interested in surgery right now. I said, if 3 months from now I'm still in this pain and nothing is working, I may consider that. And his actual response, which if you ask me, I thought was a little salty, but maybe I took it wrong. He's like, fine. He says, I'll give you the MRI script and I'll see you in 3 months. Kind of like, oh, yeah, nothing's going to work. And I was like, peace out, dude. Catch you on the flip side. I don't ever want to see this guy again. I actually do remember his name, but I'm not bashing him. I'm not saying he's a bad surgeon. What I'm saying is, why go for a second opinion? Some people would have said, oh, I'm in so much pain. This is the answer to my problem. This is the solution to my pain. This will fix me. This will help me. Not always the case. So I was reading this thing and it says only 5% of patients that have back pain actually need surgery. In my mind, I didn't need surgery. In my mind, I didn't want surgery. He was not listening to what my goals were. So that's something like if you are not comfortable with what a doctor is telling you, diagnosis, whether it be your back, whatever it is, get a second opinion, get a third opinion. We took our dog for a second opinion when we were told he had cancer, okay? A dog. Do it. Don't think that surgery is your only option. It's not always the case. There's more than one way to fix things. There's more than one way to get from point A to point B when you're driving. There's more than one way, more than one right treatment for what my issue was. Thankfully, I found that. So in my mind, I was like, all right, now what do I do? This guy's telling me I need surgery. I'm still in pain. What do I do? I need to go and get a second opinion. So I'm hemming and hawing, and I always in my mind was like, until I have exhausted everything possible to help my back, I will not go for surgery. This is my last resort. I don't care if someone said, you need to have surgery right now or you can't walk tomorrow. I'd be like, you know what? Find me a couple other doctors and I want to hear what they have to say. Because he wasn't telling me exactly why I needed surgery besides my severe pinched nerve. which, yeah, I don't believe that so much. But hey, he's the doctor, so we're supposed to believe them, right? I'm not saying that he was telling me I needed surgery and I totally didn't. I wanted other options, and that was the only option he was giving me. So you need to find a doctor that's going to understand where you're coming from. You know, is it definitive? Is this what it is? I have to have surgery and there's nothing else that will help me? No. And I've been saying this all week. You cannot undo what's done in surgery. They remove some of your discs. They shave them off. They don't grow back. They just don't grow back. You just don't have them. I'm just pulling this out of the air. I'm going to bet at least 50%. So I have a 50% chance of being right or wrong. 50% of people who probably have back surgery, A, it was unnecessary, and B, they have to go back again for a second surgery. I know a few of them that have gone back. That was not something I wanted. So I needed a second opinion. So I was like, well, what do I do? Where do I go? So some people were giving me, like, try this doctor, try that doctor. In my mind, I was like, all right, well, maybe I could do physical therapy again. I'll keep going to the chiropractor, see how that progresses. Acupuncture is something that I kind of was like, maybe I'll try, maybe I won't, was asking around. And as luck would have it, Dr. Del Rio walks into the picture, and you've seen him in the videos. If you haven't, check out episode 3 and make sure you watch tomorrow, because he'll be on tomorrow again. Here's the thing. I'm going to call that my second opinion, because when I walked in, I felt like I needed to tell him everything. Like 14 years ago, I did this, blah, 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 blah. He's like, no, tell me right now, what's caused this incident? What caused it? And the questions he asked me, I was just kind of like, yeah, I guess you really don't need to know more than what's going on right now. Like, don't tell them more than they need to know, because then they may form an opinion on, oh my gosh, just like he said, oh my gosh, you've been going to the chiropractor for how long? How much does that cost? Really? That's a lot of money. Do they cover it? Yeah. And your surgery would be expensive too, dude. But I was nice. I was respectful. He was a doctor. I was a little bit butthurt, I guess, when I walked out of there, because I was like, I am not having surgery. It's not happening. So you want to make sure, no matter what it is, like I said, we took our dog for a second opinion, that you find a doctor you're comfortable with, a doctor that listens to you, a doctor that understands where you're coming from as far as what you want to do in fixing the issue. With me, it was my lower back. I didn't want surgery because I didn't want recovery. I didn't want the downtime. I didn't want to be hurting a year later, 2 years later, 3 years later, whatever, having regret and being ticked off that I did this. So I'm like, that's my last resort. It is total, complete last resort. Find a doctor that's going to educate you on how to fix the issue, on what your options are, on your condition and how to help it, and and for God's sakes, please don't go to Google to get a second opinion or Google your symptoms, because you will overplay that and go crazy and think you are dying. Some people Google certain things and it ends up to be the common cold. If I would have Googled, I've Googled the actual surgery of a discectomy, however you say it, and I wanted to vomit, because I didn't want that done to me. So I was like, oh, that's not happening. It's not happening. Funniest thing is, when I went in to see the Dr. Del Rio right now, and I explained to him my experience with this surgeon, he's like, why didn't you question him more? And I was like, I have no idea. Why didn't I question him more? Like, he cornered me, questioning me about my insurance and everything, and I just thought he kind of wanted to know, like, what kind of coverage I have. Would surgery be covered? That's where my mind went with it when I didn't get the response I wanted from him, when I was like, well, I really don't want to have surgery. Like, what else can I do? Make sure it's someone who understands that, and they're going to educate you to where you can find out what works and what doesn't, and what all of your options are. I kind of wanted worst case scenario. Like, if I don't go get surgery and I just stay right where I'm at, what's going to happen? If I get surgery, what's the worst case scenario there? I didn't really have an answer for that. My worst case scenario was surgery, but my best case scenario was exhausting all the options to help that. So in my mind, a second opinion, a third opinion, a fourth opinion. I mean, maybe you're going to go to one doctor and be like, yeah, I didn't really understand what he wanted. He said surgery. I went to a second doctor and he was like nuts. And I wasn't exactly sure what even if surgery is what you're deciding, still go get second, third opinions, because you want someone you're comfortable with and you want to know exactly what's going to happen with you. You want to know exactly what your procedures are going to be, exactly what treatment is going to be, post-op, whatever it is. But surgery is not always the answer. So if someone is telling you that you need to have surgery, or you're getting some kind of medical diagnosis that you are looking back at the doctor like you just sucked on a lemon, go get a second opinion. There's nothing wrong with that. You're entitled to it. You should go get it, because I could have said, all right, let's do the surgery because I'm real tired of being in pain. I'm real tired of this happening over and over and over again. But I found a better solution, and I'm yes, there's an article being shared right now. I don't know if it's the same one that I'm linking to my blog. I will be linking one. I just lost it. It was, hold on, like 5 things that your doctor is not telling you and why you should get a second opinion. It's actually from a doctor's point of view, not a patient. It's from a doctor's point of view, so it will be shared in my link. I just want you guys to know that there's more than one right treatment for a medical diagnosis, no matter what it is. And I know we put our trust in these doctors, I really know we do, but I feel that, I can sit and talk with any of my doctors. I can sit and talk with my endocrinologist and ask him a million questions, and he will answer them. He will educate me. Sometimes that more than what I really was asking for, but I'm okay with that because he takes the time. I can sit with my regular doctor and she will tell me everything I want to know about. One time we had a discussion about guns. You want a doctor that is almost like your friend, that's going to educate you and tell you things. Not tell you what you want to hear. Sometimes you need to be told the hard truth, but, if you're not happy with what this doctor's saying, go for a second opinion. Second, third, fourth, fifth, whatever it takes. You don't have to live in pain, because I was at the point where I was so frustrated. I thought maybe it's time. Maybe I have to have surgery. But here I am, and I almost want to call that doctor and be like, hey, how's it going? Guess what? I'm not in pain anymore, and I didn't have to have surgery. I almost want to call him because it's been like, 4 or 5 months? Here I am. I never went for the MRI because I was like, you know what? I didn't want... Just because you have the herniated discs does not mean they have to go in and cut you. So I was just like, I'm not even going to do it. I know I have herniated discs. They haven't gone anywhere. They're still there. I know there was an article, which I see that Dr. Del Real is on, and I have it. I'm going to link it to the, spontaneous, I can't even say it, the reabsorption or whatever of the lumbar disc herniation. I'm going to share that because when he explained it to me, I was kind of like, I get it. Because for some reason I was just asking like, hey, do you think like I will miraculously heal and my discs will go back in from this therapy that we're doing? Not so much. Okay. But the fact that I did some homework, educated myself a little bit, got a second opinion, and am feeling different? How could I not share that with you guys? How could I not share that there's other ways outside of surgery and there's other ways outside of a doctor telling you this is the only thing that will fix you? Okay, go to another doctor, find one that you trust, find one that you like. Don't be someone who is like a yes person to a doctor. I know we feel like we have to be that way because they're telling us, there we go. And that was something I read yesterday. Now I'm just going to say this. Nearly 20% of the patients undergoing spine surgery will require secondary surgery. I actually did have that written down. Even if they're telling you that, go for another second opinion outside of them saying, hey, you need a second surgery, because maybe you don't need it. And maybe you're going to be really angry to find out that first surgery was unnecessary. So do your homework. Find a doctor that's going to be honest with you. Find one that's going to tell you the truth. And one that's going to educate you on your condition and how you can work with it. Because I will have herniated discs for the rest of my life, but I've learned what works, what isn't, what doesn't work, how to treat it, And I'm going to learn even more how to prevent it. So make sure that you guys are on tomorrow, because that's going to be some serious stuff as far as prevention. So that is cool too. But always, always do your homework, do your due diligence, do yourself a favor and get a second opinion. Take the time to do it. This is your back. I mean, we're talking about back, but this is your health. You can't put a dollar amount on that. And sometimes you can't get certain things back once they're taken away. Can't get those discs back once they're taken away. They'll put some fake things in there, I'm sure, some rods or pins, but how much pain is that in a few years? So think of it from that standpoint. All right, you guys, have a great day. Watch for the blog. I will post it later because it's going to have some links to some cool articles. Whatever, I saw like a bunch of articles get posted just now, so I'm going to link them in the blog so you guys can read them, because Facebook posts will go away. So it will be in my blog. Make sure you check it and read up on it. Do your homework and find the right doctor that is right for you. Have a great day, guys. Bye.